pandemic on adolescents in less and middle income countries. I would like also to start by thanking Shirin Jijuboy for organizing this session on such a topical theme issue. And I'm really pleased to chair this session. I am Jean-François Kobiane. I am a professor of demography at the High Institute for Population Science at the University for Joseph Kizerbo of Ouagadougou in Burkina Faso. So our only one unique presentation will be made by Dr. Nicolas Jones from ODI, Overseas Development Institute. And on behalf of the organizer, Shirin, and myself, and we would like to sincerely thank again Dr. Nicolas Jones for accepting to give this keynote speech on this very relevant and topical issue, the COVID-19 pandemic, and the interrelation of the relation to youth and adolescents. So thank you again for coming. So I just want also, before introducing our keynote speaker, mention that actually this is a short format session. We're thinking to something of around 45 minutes, even though organizers have allocated more, like 90 minutes to the session. We'll keep the initial format. So our keynote speaker will have around 25 minutes of presentation. And after that, we'll give a floor to the participant, and we'll have opportunity to raise questions, to make comments using the Q&A window, or raising your hand if you want to speak lively. So let me introduce first Dr. Nicolas Jones. She's she has a PhD from the University of North Carolina at Chapel Hill, and is a principal research fellow at the Overseas Development Institute in London. She's also the director of the GAGE research program, a multi-country, including Bangladesh. FCDO funded 9-year longitudinal research study on what works to support adolescent development and well-being research and well-being during the COVID-19 pandemic. The GAGE study has pivoted to remote research with over 9,000 young people in Bangladesh, Ethiopia, Jordan, and Palestine. Nicolas has more than 20 years experience carrying out qualitative and mixed methods research on childhood and adolescence in low and middle income contexts, and is the author of multiple journal articles and book chapters, and most recently co-edited the book entitled Adolescents in Humanitarian Crisis, Displacement, Gender, and Social Inequalities. It was published by Routledge in 2021. So I will give a floor to Nicolas. So, but this is actually a pre-recorded presentation. So we're listening to the video, to the presentation, and that will be, launched very soon by our technical support. Thank you.
Thank you very much. Hello, my name is Nicola Jones, and I'm a Principal Research Fellow at the Overseas Development Institute in London, and I'm also the Director of the GAGE Longitudinal Research Study on Adolescents in Low and Middle Income country contexts. So today I'm going to present findings from the GAGE study on the effects of COVID-19 on vulnerable adolescents and youth. So while globally actors are currently engaged in fighting a pandemic of enormous proportions, the needs of the relatively more healthy subpopulation of adolescents and youth may not appear to warrant immediate attention. However, emerging evidence has suggested that young people's lives have been profoundly disrupted by the economic and social changes that COVID-19 has brought about, with consequences that will likely extend into the future and perhaps intergenerationally. So in this presentation, I'll begin by briefly introducing GAGE, the longitudinal study on which our research findings are based, then turn to some of the key findings before concluding with implications from the study for programming and policy. And I look forward to your questions and answers at the end. So very briefly, the Gender and Adolescence Global Evidence Study is a mixed methods longitudinal research program that began in 2015 and will extend until at least 2024. It's exploring the gendered experiences of young people aged 10 to 19 years. We're following 20,000 adolescent girls and boys in 7 countries in the Middle East, in South Asia, and in East Africa. And the aim of the study is to generate new evidence on what works to transform the lives of adolescent girls and boys to enable them to move out of poverty and exclusion and to fast-track social change. And you can find a lot more information about the study on our website if you're interested. So the research that we carried out is framed within what we call the 3 C's conceptual framework. So at its core, it's built around 6 key capability domains that we think are critical for young people to have a healthy and empowered adolescence and ultimately adulthood. So education and learning, health and nutrition, bodily integrity and freedom from age and gender-based violence, psychosocial well-being, voice and agency within the household and community, and the skills and assets needed to promote economic empowerment in later adolescence and early adulthood. Our conceptual framework recognizes that adolescence contexts at the household, community, and national levels shape their capabilities, and it also highlights the importance of reaching adolescence through a variety of change pathways, ranging from efforts to empower adolescents at the individual level, right through to initiatives to affect change at the systems level in terms of policy and legislative changes. So I'll now move to talking a bit about the research methods and sample that we undertook in order to explore adolescents' knowledge, perceptions, and experiences of the pandemic in their respective countries. So overall, GAGE employs, as I mentioned, a mixed methods approach. So we have surveys with 2 age cohorts, so young people who at baseline in 2017-2018 were aged 10 to 12, and an older cohort that was aged 15 to 17. We then complement the survey research with more in-depth qualitative research with adolescents, their siblings, caregivers, and community leaders. And we also have annual participatory research with older adolescents to understand the peer networks that become increasingly salient over the course of the second decade of life. So in order to assess the impacts of the pandemic, we started with our longitudinal sample, which enabled us to talk with young people with whom we had already developed a reasonable degree of trust and rapport. And we undertook phone surveys with approximately half of those with 9,500 adolescents in Ethiopia, Jordan, Palestine, and Bangladesh. And then we complemented the phone surveys with phone and web-based interviews with 550 adolescents who are part of our nested qualitative sample, alongside 150 key informant interviews, including with community leaders, governmental and non-governmental service providers. We also worked with the older adolescents who are part of the participatory research groups that meet regularly in 3 of our country contexts, so in Gaza, Jordan, and Lebanon. And with these young people, we carried out participatory photography, written and audio diaries to provide additional nuance to our findings. The data collection took place at 2 main junctures between April and June 2020 to capture the immediate impacts of the initial onset of the pandemic, and then between November and February 2021 to explore the slower onset effects, including the return to school and catch-up programming in contexts such as Ethiopia. So having explained our methodology and sample, I'll now turn to some of the key findings. So what was highlighted, particularly in the first round of data collection in mid-2020, was that poverty and food insecurity in the households in which adolescents were living rose sharply. So in urban Ethiopia, we found, for example, that 45% of households lost employment, and in Jordan, just 43% of households could meet food needs, and only 16% of households could afford health insurance. So as this 19-year-old girl from Bangladesh underscores, food insecurity was a major challenge for many adolescents at this time. We've changed our meals. We used to take at least a good meal every day, like fish or something, but now we can manage only what we can afford. And an 18-year-old mother in Ethiopia similarly reflected, what is the relevance of staying healthy if hunger is going to kill you any day? If corona kills me, it would be a relief from this life. I just feel sorry for my son. So we also learned from our research that learning was severely disrupted, particularly for young people from poor and rural households, as they were especially likely to lack the hardware and connectivity that they needed to access learning platforms. They were also the least likely to have parents who were able to help them to study at home. So across context, our findings indicated that there have only been limited attempts to use classroom teachers to support distance education, and very few students reported having had recent contact with teachers. With poverty increasing and child labour a more prevalent coping strategy as lockdowns have eased, it is extremely likely that many young people who were sent home in March of 2020 will not return to the classroom. And indeed, we have seen this in the case of Ethiopia when schools reopened in November after 8 months of closure there. And I just want to highlight some of the challenges that young people faced. So you can see from this quote here from a 14-year-old girl in Gaza that she says, I can't follow up on my studies after school closed because we have only one mobile phone at home and the internet connection is very weak and limited. We have a package with limited internet speed. There is no mobile phone, no computer, no laptop. COVID has reduced girls' access to education even more than boys. So our findings indicate that girls not only have had less time than boys because they're responsible for increased domestic and care work, but they've also had less access to the technology that they need to utilize learning platforms, as well as less support to pursue education. Lack of access to sexual and reproductive health care, alongside increased pressure to conceive and too much unstructured time, has in many cases resulted in adolescent pregnancy that is likely to permanently truncate educational trajectories, especially for married girls. So as an 18-year-old married Syrian refugee girl living in Jordan emphasized, people say to me, this is in vain, it's fake studying. I try as much as possible not to listen to them or even to respond. So access to healthcare, especially sexual and reproductive healthcare, has been disrupted again across contexts. And two groups of young people in our research sample emerge as being especially vulnerable to the healthcare disruptions wrought by COVID. So girls needing sexual and reproductive health care and young people with disabilities. So engaged focal countries where adolescent pregnancy is overwhelmingly associated with child marriage. Married girls reported they were unable to access contraception, that they were under increased pressure to conceive, as I've mentioned, and also unable to access antenatal care. And in many cases, they expressed significant concerns about how and where they would be able to deliver their child. Young people with disabilities also reported disruptions to care. Specialist care was difficult to come by even before the pandemic, and has become more so given that travel restrictions are in place and household incomes are severely reduced. So as a district health worker, key informant highlighted to us in Afar, Ethiopia, in this evil situation of the COVID-19 pandemic, women are suffering due to childbirth and in our locality are dying due to excessive bleeding after they give birth. Our findings also show, in line with broader global findings about the spike in gender-based violence due to lockdowns and people spending increasing amounts of time at home, that age and gender-based violence for adolescents is also a rising concern in the context of the pandemic. So with the survey interviews, because they were telephone based and therefore we couldn't guarantee confidentiality, we were unable to ask adolescents direct questions about their own experiences with gender-based violence. So instead we used more general questions, which suggested that gender-based violence has become markedly more common since COVID began. So, for example, in Bangladesh, 22% of married Rohingya girls reported that gender-based violence had become more common, and more than half of the adolescents in our samples in Ethiopia, Jordan, and Gaza reported that household stress had increased as well. Increases are in part due to growing financial stress and in part due to increased hours together. During the weeks and months of the strictest lockdowns, young people also reported increased violence from the police. For those who could not afford to stay home, the threat of violence was a near constant, and we also found that reporting avenues were curtailed. So in Ethiopia, for example, where school teachers and health extension workers tend to be the first port of call to report violence that adolescents may face, this was very challenging during the pandemic, as many had returned either to their hometowns and were no longer present in rural locations, or they were working from home in the case of health extension workers. while we found that in urban areas there was not necessarily an increase in child marriage, particularly because adolescent girls wanted to ensure that they were able to have a party or a celebration for their marriage. In rural areas in Ethiopia, we did see a spike even during the early onset of the pandemic in the rate of child marriage. So over the last decade in Ethiopia, as access to education has expanded, the youngest girls have been relatively protected from child marriage by dint of the fact that they were enrolled in school. However, when girls were sent home in March of 2020, that protection disappeared for many. Girls also lost access to their protectors, given that teachers were often the first link in the reporting chain that could see arranged marriages cancelled. And as I'd mentioned, teachers in rural communities were largely sent home when schools are closed, and higher level officials were unable to visit, given restrictions on travel between urban and rural areas during the national state of emergency that lasted until August of 2020. In the regions of Ethiopia where child marriage is increasingly adolescent-driven rather than parent-arranged, free time is resulting in risky behaviors that are also likely to culminate in child marriage. So a 19-year-old youth in East Harare reported that both girls and boys are now all rushing to the Shigoye, traditional adolescent-only dance in the evenings. Many of them have started love relationships among themselves. The school closure has created good opportunities for them, and this was seen as a precursor to adolescent marriages in many contexts. And as a 17-year-old boy in another part of the country argued that previously girls had their teachers to whom they could report if they were being forced into marriage by parents, and the teachers could even take the parents to justice. However, now children do not have these opportunities as schools are closed and teachers are not in the locality. What was very sobering about our findings was the extent to which they highlighted the ways in which the pandemic is having a significant toll on adolescent psychosocial well-being and mental health. Our findings underscore that there are increasing rates of anxiety and depression. So for both girls and boys, financial stress is creating significant stress, and for girls, their psychosocial well-being is being additionally impacted by more extreme social isolation. So across countries, our findings show that girls are far less likely to leave home on a regular basis than boys, even prior to the pandemic, and they have been less able also to access technology that facilitates social interaction with peers. So as an 18-year-old Syrian refugee girl living in Jordan explained, I noticed that I have symptoms of depression. I sleep all day. I don't like talking to anyone. I don't laugh. I hate myself, and I don't like the things I do. Sometimes I can't sleep until dawn. Our findings also highlighted that students with disabilities feel particularly abandoned by service providers. And this quote here by an 18-year-old Palestinian girl with a hearing disability in Jordan underscores some of the challenges. So she explained that I'm alone, even though I'm locked down with my family. I'm deaf and there's no one at home who understands sign language. I sketch to keep myself occupied and to remember happier days when I could take drawing classes and encourage others to stay at home by painting messages on my clothes. So I'd like to conclude now by discussing some of the implications of these findings for policy and programming. So firstly, our findings highlight that the most vulnerable adolescents are not being reached by emergency social protection programming, and that financial stress and food insecurity is a critical challenge. So a key implication of this would seem to be investments in scaled up cash transfer plus programs to address these economic vulnerabilities and food insecurity, and also to ensure that adolescent girls have access to hygiene supplies, including menstrual hygiene supplies. And that such programming needs to target families as well as adolescents living alone or married adolescents who are often excluded from such social assistance programming. Secondly, our findings underscore that as adolescents return to school, it will be critical to include outreach to the most vulnerable, especially to girls and adolescents with disabilities, and also to invest in catch-up tutorials given significant periods of time outside of face-to-face learning opportunities, and particularly for those who haven't had access to devices to access online platforms. Our findings also suggest that it's essential to invest in strengthening the accessibility of distance learning options for all in case of future lockdowns and/or hybrid education approaches, as we're seeing in Jordan, for example, where adolescents are spending 2 to 3 days in the classroom as of September 2021, and 2 to 3 days per week still learning via online platforms. Thirdly, it's critical to resume health and sexual reproductive health services, especially for pregnant girls and adolescent mothers and adolescents with disabilities who require specialist services. Given high levels of anxiety and fear that were expressed by adolescents across contexts, it's also key to be investing in low-cost peer-to-peer and community-based social, psychosocial support to tackle rising levels of anxiety and depression. And lastly, it's essential to both resume and expand gender-based violence and child protection reporting mechanisms and responses given heightened household tensions. Measures are also needed to address growing levels of community violence by citizens and state authorities. And finally, reporting channels and supportive services for girls and boys at risk of child marriage need to be reactivated, especially during cultural wedding seasons. So if you'd like to find out more information about any of these aspects of our findings, we have a range of reports and policy briefs online. You can also access the survey and qualitative research tools that we used for the data collection that can be adapted to other contexts. And finally, we have a number of recent academic publications that may be of interest. Thank you very much.
Okay, thank you very much, Nicola, for your presentation. I think we can go ahead with the question, and or do you want to make any live comment before we go to the question, Nicola?
No, that's fine. I'm happy to go directly to questions.
Okay, good, good. So I've just seen a question in the chat. Let me have a look on it. A question for one participant: what access to education did adolescents have in camps prior to COVID-19? Do we have information on levels of learning to design catch-up tutorials?
So thank you, Sajida, for that question. I think it's a very good one, and there's great diversity in the refugee populations that we've been carrying out our research with. So in Bangladesh, as you would well know, the Rohingya adolescents and our sample did not have access in the camps to formal education prior to the pandemic. Approximately, from memory, half of them were attending especially boys, non-formal education classes at the learning centers that UNICEF and others were supporting, but that was, it wasn't formal education. So that's a very different scenario to what we see, for example, with our sample in Jordan. So in the Syrian refugee camps, adolescents had relatively good access to schooling right through to the end of 12th grade. We did see a rapid drop-off in school attendance, even though schooling is available in the camps right throughout secondary school once adolescents reach mid-adolescence. So particularly for boys, the risk of child labor. So many boys leave the camps during the day to try and support their households in the camps. Refugee households don't have access to cash transfers. So while services and food are provided, many families rely on their children, especially boys, because of conservative gender norms to fulfill that role and to support family incomes. And for girls, there are strong pressures for many to marry at quite a young age, and especially as the economic crisis has deepened. So, but I think that we do have, a good profile, particularly for young adolescents, as to what grades they were in pre-pandemic. So I think in terms of informing the catch-up tutorials that you're talking about, there's good information there. For Palestinian refugees in the camps, they have access to schooling that's provided by UNRWA up to grade 10. And you have the same kind of dynamic in terms of pressures for mid-adolescents to be, either engaging in the case of boys in child labor or girls in child marriage. You do see a major drop-off in terms of higher secondary enrollment because the UNRWA provision only goes to the end of grade 10. And so for grade 11 and 12, they have to leave the camps, and often transportation is a concern. But yeah, I think we have good information on that. The scenario in Lebanon for the Palestinian refugees is also analogous. So I hope that answers at least part of your question, but happy to follow up on that further.
Okay, thank you, Nicola. A second question from Anastasia. Adolescent well-being is closely tied to the parents' well-being. What program activities can be implemented for parents to help them mitigate the effect of COVID-19 on their adolescent children?
Great, thank you, Anastasia. So it's a really good question. I mean, here I think I would look to an example of promising practice from what we saw with the Makani integrated child and adolescent program that UNICEF Jordan coordinates. So it's a program that reaches about 100,000 refugees and vulnerable Jordanians across the kingdom, both in camps and in host communities. It's been going for about 5 years, and they were able to, because they already had community centers and close linkages with adolescents and parents prior to the pandemic, they were able to pivot very quickly once the lockdowns and the online or the distance education started to provide online support. So Jordan's a context that has high levels of connectivity. I think about 70% of the population have access to the internet, including many refugees who prioritize that, given the need to stay in contact with families across borders. And there they started providing messages via WhatsApp and text messages to parents about advice on how to stay safe, particularly in the initial period when there was less known about prevention measures for the COVID infections, learning activities, suggestions to parents to support their children, and then quite a lot of focus on simple messaging around sort of psychosocial first aid. So, what families could be doing in order to, cope, what kind of positive coping options there might be. And also they sent out regular short videos with suggestions, particularly as to how they could interact with their young people at that time and what kinds of symptoms they should be aware of. So that, I think, has been is a very interesting model. And they have now, with some EU funding, have followed up on that and been able to distribute tablets to 20,000 young people, primarily refugees, but also some vulnerable Jordanians in the host communities. And that's also further facilitated access to online support and access to psychosocial first aid materials.
Okay, thank you. Another question from Kofi Awazabo Azare. What struck me but not surprised is the level of mental health challenges. Can we learn from some of the mechanisms that have been put in place to address mental health challenges, especially of persons with disability?
Okay, an excellent question. And yes, just to say, I think that was something that we saw across all contexts, the elevated levels of both anxiety and depression. And from our qualitative studies, also, we heard repeatedly about an increase in ideation around self-harm and also ideation around suicide. So it was very, very stark. In terms of coping repertoires, there's initiatives, the program that I mentioned, the Makani program in Jordan, I think was very positive. I think what came out very strongly, particularly for girls who tended to face greater levels of social isolation, because whereas boys in most contexts were still being permitted by parents to leave the home and to have some face-to-face interaction with peers, that was much more limited for girls in all contexts. And so I do think, at least in contexts where there is access to connectivity, either in urban environments or environments where there is some level of connectivity, providing subsidized phone credit, online internet, data packages seems critical to facilitate access to peers online. For rural communities and their communities such as rural Ethiopia, where our sample is, where that's just not possible, then finding means to have connections with trusted adults and peers seems critical. So we did find that some teachers were taking the initiative to check up on adolescents, where health extension workers were doing that, but tend to be very ad hoc and very slow for local governments to organize anything in a systematic manner. So I think one of the key learnings has to be, how can we continue to invest in providing connectivity and affordable devices to people who may have to be taking part in hybrid online and in-person learning, and then for rural communities to really be ensuring that there are ways to safely socially distance and still provide access to peers,
and access to trusted adults outside the family, particularly for protection reasons. If we think about then young people with disabilities, what was concerning across all contexts was the limited attention to adaptations of any kind of learning platforms. So we heard repeatedly from young people that while they were noticing that their peers might be getting access to at least some kind of online access or some form of distance education, that they were being excluded from that. You know, in the case of young people with hearing impairments, because their families didn't necessarily have the signing abilities to be able to interact with their children, to support them with their learning, that they were feeling particularly isolated, that many of them emphasized how much they depended on access to peers in the classroom and to teachers in order to be able to you know, have in-depth conversations and communication. So I think there really needs to be a much greater focus and thinking about it from a very disaggregated perspective so that tailored support can be provided. And then for the other real challenge that requires, I think, public awareness raising was the sort of renewed sense of stigmatization and discrimination that young people in Ethiopia, for example, with disabilities, reported to us, that whereas they had previously been able to rely, for those who had, say, physical or visual impairments, on support from community members to you know, move around their environment, that then became much more challenging once the pandemic hit, and that they were much more vulnerable. And a second key concern that was highlighted was that some of them were recipients of social assistance to attend education, but that those cash transfers were suspended, those educational stipends were suspended when schools were closed. And that then left them particularly vulnerable to food insecurity. So I think these are all yeah, challenges that we need to pay more attention to and sort of future planning you know, for pandemic preparedness.
Okay, thank you, Nicola. Another comment and a question from Salam Khan. Excellent presentation and findings as well. I fully agree with your findings. However, may I know how many adolescents you have interviewed in Bangladesh? And how many of them are from rural area? You know, there are 36 million, I guess, adolescents in Bangladesh. My question is actually about the sample size that can fully support your findings.
It's a very good question. So our sample in Bangladesh is made up of 3 different blocks. So we have a sample with approximately 2,000 adolescents in Cox's Bazar from the Rohingya communities, and that's nested within a broader panel survey that's being coordinated by Yale University, IPA, and UNHCR. And so the gauge sample is nested within that larger study, which I think has 5,000 young people from Cox's Bazar. So that's the first part of our sample there. The second, we have a sample of close to 1,000 young people from impoverished urban settlements in Dhaka. And then thirdly, there's an additional sample of 3,500 from memory, or I can send you details by email if you would like, in Chittagong and Sylhet divisions, both urban and rural. So it's not nationally representative, but it does include rural young people, as well as you know, Bangladeshi nationals and Rohingya refugees. So I'm not sure if that helps with that question.
Okay, thank you. I'm not seeing another question, but I have 2 myself.
Okay.
Nicola. Okay,
sure.
Thank you again for your nice presentation. My first question is about the methodology of, you know, asking the questions. And as this is a longitudinal frame, actually I was I realized that most of the figures against is based on a declaration, if I'm right, because most of the time you say people have reported, young adolescents have reported. For example, I give an example of Ethiopia, when it's stated that in urban Ethiopian, 45% of households lost employment due to COVID-19. I'm wondering, is it a comparison of the level of employment just before the COVID-19 and then later during the data collection, or is the kind of report, declaration from the household member?
So it's a good question. So here that was self-reported from both adolescents and their caregivers. However, we do have data collection that was undertaken at 2 intervals pre-pandemic. So at the end of 2017, early 2018, and then just before the pandemic, so late 2019, early 2020. So I didn't present those figures here, but we do also have that comparison, because without having done the pre-pandemic data collection, we wouldn't have been able to mobilize access to such a large sample so quickly, because we were already doing the questions on COVID for the quantitative phone surveys by June. So, very soon after the national emergency, there was a national emergency declared in April of 2020, and we were able to start asking quantitatively already in June of 2020. So if there's specific indicators that you'd like to see, I'm happy to follow up, but you're right, in this presentation, just for time reasons, I didn't do that.
Okay, thank you. And my second question is about still about education. Are you collecting data on the quality of education? The literacy or the level of skills, student skills. I'm asking this question because one of the hypotheses regarding the use of internet, online, mechanism actually to give opportunity to students to continue learning. Actually, one of we have seen this also in other settings like in Burkina. The Minister of Education has developed a lot of tutorial on TV, on the radio. But at the time where in the population there are less people who have access to this equipment, so it means that in the long term, this will contribute actually to some extent to increase inequality between the poorest and the richest. So this is why I'm asking this question. Are you, planning actually in your research to look at this later, how the COVID-19 can also be an opportunity, or not an opportunity, but also contribute to increase inequality?
Yes, so we have data on basic literacy and numeracy, so where young people were assessed pre-pandemic in terms of their reading level and sort of basic mathematical skills. We did not do that because it requires sort of face-to-face and writing for the assessment, but once we're able to return and do in-person interviews, we do plan to do that. Because I think qualitatively, you're exactly right, what we're hearing in all contexts, both urban and rural, that those young people from more vulnerable socioeconomic backgrounds, even if there was physical access to a TV or an internet, they often didn't have access to the device for very long. They were rushed doing their homework. They had to share it with another sibling, or the family could only afford an internet data package for 10 days, not for the whole month. They couldn't ask their parents often about questions because the parents may not be literate. So there was all kinds of challenges. So I think we're going to see huge challenges in terms of learning loss. So it's not just a matter of who has not returned to the classroom. So for example, in Ethiopia, it was shocking. They estimated that maybe 5 million out of 25 million students who were enrolled pre-pandemic had not returned in November. So already a huge drop-off in terms of adolescents even staying in formal education. But then, as you're saying, we now need to look at what the medium-term learning loss is. And I think someone had asked a question about the catch-up tutorials. I mean, I think, you know, governments made a good faith effort in some cases, but they were often very truncated. So again, using the Ethiopian context, I think they were given 20 days catch up, but then automatically promoted to the next grade when already they'd forgotten the content from the previous year, let alone being able to then cope up with the you know, next grade up. So yeah, I think it's going to be a major issue for us to keep on top of.
Thank you very much, Nicola. I think I'm not seeing another question, but I think we are almost done, or we have 5 minutes past. So if there is no additional question, I would like to, you know, on behalf of all of you, thank again Nicola Jones for, you know, giving us this very, very interesting and presentation on COVID-19, youth, adolescent, and COVID-19 all over the world. And also thank all of you for attending this session. As you know, you will get the opportunity also to have a look on the recorded version. But I want to say that the organizers are also, they are also planning a kind of offer audience discussion after the formal session. For those who want to stay, if Nicola is available, we want to stay after the session, they can interact with the keynote speaker and for additional issues and the way forward. Thank you again to all of you. Thank you, Nicola. Thank you to Anna for the technical assistance. And I wish you again a very nice conference, and we keep in touch. Bye.
Thank you very much. And thank you for all the great questions.